Hello, and welcome to Community Pulse, a public affairs show on CAN TV about public health in Chicago. My name is Levi Moore, and I'm one of the two rotating co-hosts for Community Pulse. Today, our guests are Cheryl and Brittany Sanchez. Ladies, thank you so much for appearing on Community Pulse with us.
Thank you for having us here.
Thank you so much.
Okay, now before we start our chat, I have a little bit of housekeeping to do. Okay, Community Pulse is an outreach and health education vehicle for the Foxglove Alliance, a coalition of 15 public healthcare organizations in Chicago. And I serve as the Foxglove Alliance coordinator. Both Community Pulse and the Foxglove Alliance are sponsored by the Hectone Institute of Medicine, an 80-year-old not-for-profit institution that is dedicated to addressing some of the most pressing health concerns facing underserved populations in Chicago. Now, with that out of the way, let me sort of frame this. We're going to talk about two things. I think it's a special show. We're going to talk about two topics. We're going to talk about clinical trials, and we're going to talk about lupus. And you'll see how they connect once we start our conversation. We were brought together because of the Walgreens Patient Advisory Board. All three of us are members, and that's how we met. I think, what, November, December, something like that? Yeah.
Last year, yes.
Yeah, so in case you all didn't know, you should know, but you'll hear it again. For the last 4 years, the top initiative priority of the Foxglove Alliance has been the M3R campaign. M3R stands for More Minorities in Medical Research. And the goal is to get more Black and Brown people in Chicago to participate in clinical trials. And the Walgreens Patient Advisory Board was set up to help inform and to get more people into clinical trials. So it's like a perfect match for today. And, you know, before we start, let me make one thing pretty clear. Okay, this conversation is broad. It's not to be about more minorities in medical research participating in clinical trials. It's about everybody. But M3R is not about DEI. It's about health. And anybody with chronic illnesses, chronic conditions, should be able to take advantage, benefit from the wonders of medical science that are being developed every day. So, you know, that's the purpose. Now, I'm off my soapbox. And, well, Cheryl, Brittany, before we get into the medical stuff, who are you? Where are you from? What do you do? And folks, in case you haven't figured it out yet, they're mother and daughter.
Well, thank you for that. I'm Brittany Sanchez. My mom and I are originally from the Bronx, New York, and now we're up in Westchester, New York. I'm a lupus warrior and an advocate, so I try to speak out on lots of things like clinical trials and lupus. I have a degree in biology, and I'm currently working on my master's degree in nutrition so that I could become a dietitian.
Great. Do you graduate soon?
Next summer.
Oh, okay. I was going to get you a gift already, but okay, I'll wait.
I got to pass the RD exam first.
Okay. Cheryl.
So hi, I'm Cheryl Sanchez. As Levi mentioned, I'm Brittany's mom. I have both a bachelor's degree and a master's degree in business, and I've worked in the healthcare industry now for over 30 years. I'm also an author and the founder of an organization called The Networks, which is all about connecting people to help them be successful in whatever it is that they want to do. And we really appreciate the opportunity for being here today, Levi.
Okay, great. Now let's really get to the meat of it. We're going to go through why are clinical trials important to you? How they impacted your life?
So I think I'll start with that, and I'll say that I was first introduced to the whole world of clinical trials many years ago. I won't say how many, Brittany. When Brittany was a child, and I was a single mom raising a child in the Bronx, and I was looking for different treatment options for her, and was introduced to the world of clinical trials because it offered access to a higher level of diagnostic care, for one, and also a new medication that we otherwise wouldn't have had access to. So the clinical trials just really brought an opportunity that we wouldn't have otherwise had access to. And that medication actually turned out to be a successful treatment option for Brittany back then, and it went on to become a approved medication.
Now, caregiver, patient, your perspective.
Yeah, so my experience with clinical trials, I don't know if I've ever actually been a patient in one, and I don't know exactly the reason why for that. I think it's been the caregiver perspective, and really, particularly back then as a mom, making sure that I researched everything. I looked into where we were going, what the process of clinical trials was, what the responsibilities were, what the benefits were, which I thought was really important to the whole process. And I'm really, really appreciative as a caregiver, as a mom, for the opportunity that having my child participate in this clinical trial what just offered to us as a family.
Brittany, were you scared or, going into this?
Yeah, so for my first clinical trial ever, I just didn't even know
Oh,
it was any different when I was a kid.
mhm.
So I just thought I was going to a cool doctor and it was just like another kind of regular doctor's appointment. But then flash forward to 2020 and I was diagnosed with lupus. Lupus is an autoimmune disease where the healthy immune system in your body that's supposed to protect you from outside things like bacteria and viruses actually gets confused and starts attacking yourself. So lupus can affect many different parts of your body and affects people in different ways. And so it's actually pretty hard to treat and there's no cure. So when I found that out and I saw this is the diagnosis that I got, I was like, we're right by New York City, so I want to see the best of the best. And I went straight to lupus doctors in the city. And then they brought up clinical trials to me. So
Okay.
that that was my like more my personal start with clinical trials.
Mhm.
Um and it was a little scary when it was a treatment that hadn't been approved yet. But all my doctors always are monitoring you closely. These have
Yeah.
already been tested with maybe other people for other diseases or things like that. And so they did a really great job of making me feel really safe and supported.
I guess I'll weigh in a little bit. Big surprise to the viewers. Okay. I participated in a clinical trial. I also have two autoimmune conditions and what is Crohn's disease and an arthritic condition called ankylosing spondylitis. And much like lupus, the way the doctor had explained to me is that our bodies are smart. They try to protect us, but what if there's a Trojan horse, if there's a fake attack, and then your body thinks it's defending you, but it's actually attacking you. So I totally get that. And how often, and like you, and unlike some other members of the Walgreens Patient Advisory Board, we were lucky in that the physician suggested it. Like my physician literally found my trial for me. But then I've heard of other people who it was an ordeal trying to get into one. So, I always say, like, you know what? I got lucky on that one.
I think it's also, Levi, just to jump in there, I think it's also important, to be an advocate for yourself. And the more that you press for, questions and answers about your diagnosis and treatment options and what's available to you, I do think that that has an effect on the communication and the relationship with your healthcare providers to perhaps offer something that maybe they don't, unfortunately, if you aren't that inquisitive.
Uh, our viewers heard a little bit about what, why do you think it's important for people, communities to know about clinical trials, just from your perspective?
From my perspective, there's a bunch of reasons. Similar to the story that I was talking about as a single mom with my kid, it was an opportunity to provide access to a level of care that I really didn't have available to me. And that could be due to barriers like cost. It could be health insurance coverage, lack of health insurance coverage, other barriers like socioeconomic barriers. And it also really allowed for a newer treatment option that wasn't yet widely available. And so from my perspective, I think that those are all things that are really important for people to be aware of with clinical trials, that they can offer all of those things.
Yeah, and then from a patient perspective, I feel like it helps you to be feeling more proactive in your own medical treatment, gives you kind of like a sense of agency that you can take action and start advocating for yourself, and feel like you're really doing something to help this situation rather than it just kind of like happening to you. It definitely gives you like this feeling of empowerment. But then on a community level, historically, clinical trials have not been representative of all demographics, such as race, gender,
Yeah.
socioeconomic status. And so while we make clinical trials more well known to the community, we can try and get more people involved and have more realistic study groups that can lead to treatment options that work for everyone.
Yeah, I know just with the MTR campaign, we've tried to explain to people that let's just take Black and brown people, that if we are not in clinical trials, and this is when it came to light, it was during the pandemic, and one of the Fox Glove Alliance members, his real job, they were trying to come up with a COVID vaccine, and they were tearing their hair out because they didn't have enough Mexican American or African American participants. And they said, if we have to do this, because if not, this drug may not work on them. And when I know when I convey that story to people, I get their attention immediately. So now,
I think just to add to that, Levi, I think it's one of those things that you don't think about until you think about it. Like
yeah,
take a medicine and you just, I guess, kind of assume that it's, been tested on people like you. And you just don't think about it that it might not have been tested on people like
yeah,
you.
yeah. Now, out of curiosity, is how you were in what, 2 clinical trials, Brittany? Okay, how long were they? How intensive were the visits?
So I've been part of the three actually. Yeah, I've been part of three. What's funny is the last two, the one that I'm in right now and the one before that, are total opposites. So
Huh,
I did one where they were testing a medication to see if it would help with lupus brain fog, and that involved going and getting MRI scans, going and doing these tests to test my memory and stuff like that.
yeah,
So that was a little more intensive, and then I would go and get my blood work done and stuff like that. um so that one's done, but now I'm doing one about a vaccine, and what I'm doing is I just go and I get the vaccine or the placebo, they check my blood work, and that's it.
oh, wow.
And that gave me access to the Shingrix vaccine, which isn't open yet for autoimmune diseases, but they're hoping to
Mhm.
open it up to younger people with autoimmune diseases. So it just gave me access to something that I kind of wanted to get anyway, since people with autoimmune diseases are more likely to get sicknesses. So it was like a win-win. I just go get my blood work done, and then they gave me either the shot or the placebo and just had me fill out if I had any side effects.
Great. And folks, that was very important because sometimes clinical trials are set up where it may be for an approved drug, but it's to see if people of a certain age can take it, young people. The one I was in, the key was that they were looking for people that had two very specific conditions, and that's why I was a fit. And that's what mine was also different. Mine was 8 years, once a month examination. But I always told us that I had platinum health care because of participating in the trial, so it was a big plus. Well, you know what? Let's talk about why you decided to join the Walgreens Patient Advisory Board.
I think for me, one reason was that Walgreens offered us the opportunity to participate together as both a patient and a caregiver. And I think that really provides a unique, well-rounded perspective. And we also know that Walgreens is located in so many communities that could benefit from this type of information. So we felt that we could really make a difference as part of this team.
Brittany, anything to add?
Yeah, I definitely think we had already started doing some advocacy for things like lupus, and then also clinical trials once I had started getting involved in them more. And then when we met the members of the Walgreens team, we just felt like it would be a great fit for us, and it was just a great group of people.
Yeah. You know what? Let's shift since that was a transition. May is National Lupus Awareness Month. What do you think we should know about lupus that most of us don't in your journey?
So lupus, as we talked about before, it's an autoimmune disease. It can affect any part of your body though. So a lot of
Right.
other things like rheumatoid arthritis, your immune system is attacking just your joints. But with
Mhm.
lupus, it can attack any organ system. And so
Oh,
that actually means it can be a completely big mix of different symptoms for each different patient. So I had joint pain, fatigue, brain fog, skin rashes, things like that. But some people, since it's kind of harder to diagnose because of these mix of symptoms, some people don't even get diagnosed until they have organ damage, like kidney failure or heart problems. So one of our biggest goals is to raise awareness so people just know more about lupus and know that if you think something's wrong, you got to advocate for yourself. Go to another doctor, ask for another test, do whatever you can, because it took us a few years of my mild symptoms being brushed off until I had more of a big flare up. And then I told my doctor, test me again when I had the flare up.
ah,
And that
mm,
is why I got my diagnosis, because I called him and said, run it again right now, since I know that this is different than how I usually feel. And
you
that's
knew your
why,
body wasn't right.
yep. And that's why I got a diagnosis before it could get to start doing damage to my major organ systems.
Okay, I know that I think you're young enough where it's still cool to ask you your age. How old were you when you were diagnosed?
20,
Yeah, actually, when it started and when you were diagnosed. So those would be two different times.
so it started, I'd say when I was like 24.
Okay.
I realized that I was just more tired than all my other coworkers and that I was getting sick more often than everyone else. And that's when I started going to doctors, and they would kind of brush me off, being like, oh, well, it's that time of year. Oh, well, maybe it's just depression and you're tired, and oh, you work with kids, don't worry about it. But I kept pushing, my mom kept pushing, my mom came with me to all these appointments, she helped me find new doctors. We have like a stack of papers like this big of all the tests run before I got my diagnosis. And it's really because we kept pushing and pushing that I got to get my official diagnosis before, anything really devastating happened.
I think
Have
one
you,
important point about lupus is that it disproportionately affects women and people of color,
uh,
which really ties in with the clinical trials and advocacy and making sure to get the word out, because they're the people most likely to be affected by it, and they're also the people that most likely to not have the information about it, and also the people that are more likely to encounter those types of barriers and obstacles in navigating the healthcare system. And absolutely, persistence is the key. If something doesn't feel right, you keep going back until you find out what's going on.
we're getting kind of close to time, but I want to touch on, okay, we joined the Walgreens Patient Advisory Board in November, December, and we have a 2-year term. So now we're the not part of the inaugural group. Flash forward. What do you hope that we can accomplish after our term is over?
I think one of my biggest things is just getting the word out and making things like clinical trials, healthcare information more available and accessible to everyone, because there's just so many barriers that even someone like me who has a degree in biology and my mom who worked in healthcare, it still took us years to navigate things, and I'm still learning
Yeah.
stuff every day. And so we just want to be that voice to get people to know more, and then they can make the full healthcare decisions that they want to do. If they want to do clinical trials, or if they want to, find a new doctor, try a new med, then they have all the options and all the information to be able to do that.
Yeah, out of curiosity, when did you realize that you were a patient advocate?
That's a good question. I think I've always been outspoken, and so
Mhm.
I know that, say, like when I would get brushed off, I would just get more annoyed, and so then I would be like, "No, there is something wrong. I'm gonna push." And so, I had the support of my mom. I would find another doctor, things like that. And then finally, I just realized once I was diagnosed with lupus and I became part of this chronic illness community, that so many other people weren't talking, like speaking up for themselves. And that's when I realized, I was like, well, that's why I'm in a better position than a lot of these other people. And I feel like I'm very lucky and privileged to have the support that I have. And so I'm in this position that I can go out and I can speak and I can try and raise awareness because I'm supported and have a good, stable life. Um, so I thought that this feels like what I'm supposed to be doing since I have this opportunity.
And Cheryl, you're kind of right there with her too, right? As an advocate.
Absolutely. I think similar to Brittany, I've always been the same kind of outspoken advocate for the underdog always. And I think that just translated into um, after seeing the difficulties navigating through the system with the privilege and access that we had, and just recognizing how difficult it was for us to be able to do that, and knowing that not everyone has that same level of privilege or access. And it just, I think, inspired both of us that we really need to get out there, share information, raise awareness, fundraise, and really advance access and representation, and help people advocate for themselves.
Okay, great. Anything else before I wrap up?
Oh, I just think
Okay.
our biggest thing is to always get all the information, so that you can make your own decisions and to, yeah, stick up for yourself. That's the biggest thing that we want everyone to take away from everything.
Okay. Well, hey, everybody, it's about time to shut down, but I want to thank our two guests today. Cheryl and Brittany Sanchez, my colleagues on the Walgreens Patient Advisory Board. And like I said, I'm one of the 2 rotating co-hosts for Community Pulse. The next show will be done by Takora Love, one of the leaders of the Academy of Medical Oncology Nurses Chicago chapter. So with that, enjoy.